Hi everyone, my name is Issa Justin Joseph at ICAP South Sudan, and as ICAP is a peace-led initiative, and today we are going to look at mental health impact on peace in post-conflict society. And under mental health impact on peace in post-conflict society, we will first look at the definition. What do we understand by the word mental health? Mental health is a state of well-being where individuals realize their potentials to cope with normal stresses, work productivity, and also contribute to their communities. For now, we'll look at the importance of addressing mental health in society recovery from conflict, and it's crucial for lasting peace. We will look at the effect of conflict on mental health. Under effect, we will look at trauma. Exposure to violence, loss, and displacement leads to widespread of trauma. For example, in South Sudan, many people have witnessed the loss of loved ones or their homes being destroyed. This often leads to chronic stresses and hypervigilance, where people are constantly on edge, struggling to trust others. We will, under the effect, we will also look at the PTSD and depression. High prevalence of PTSD, depressions, and anxiety among survivors. The veteran from the war zone for years, in most cases, frequently exhibit symptoms of PTSD such as flashback, nightmares, and emotional numbness, which affect ability to reintegrate with others and connect with others. Under this, we will also look at the social fragmentation. Mental health issue contributes to distrust, fear, and social division, hindering community cohesion. For example, lingering ethnic tensions are exhibited by untreated trauma, leading to isolating themselves and avoiding interaction with other communities, which perpetuate division. Under this, we will look at also mental health and peace building. How are they connected? Healing and reconciliation. Mental health support foster individuals' healing, which is essential for collective reconciliation. For example, programs that combine trauma counseling with community reconciliations effort have allowed former child soldiers and their community to forgive the past atrocities and work together to rebuild their villages. We will also talk about violence and prevention. Untreated mental health issue can lead to cycle of violence, undermining peace effort. For example, former soldiers who have received mental health support were less likely to return to violent behavior compared to those who do not receive such support. Then we will also look at community resilience. A strong mental health service build resilience community that can withstand future challenges. For example, research have shown community with access to mental health resources have shown greater resilience in dealing with ongoing social and economical challenges, maintaining relative peace compared to those without such support. Under this, we'll look at the mental health challenges. Stigma is one. Mental health remains stigmatized, leading to underreporting and lack of support. For example, people often hide mental health issues out of fear of being seen as weak, resulting in untreated conditions that worsen over time and affect entire family and the community. We will talk about the resource scarcity, limited mental health infrastructure and professional in post-conflict regions. Sometimes a few available mental health services are often overwhelmed, leading to long awaiting time and inadequate care for those in desperate need. Under this, we will also talk about the cultural sensitivity, need for culturally relevant mental health intervention that respect local traditions and beliefs. For example, mental health programs that incorporate traditional healing practices alongside modern counseling therapy have been more successful in engaging the local population. Recommendation 1. Integrated approach. Combining mental health service with peacebuilding program. For example, integrating mental health care into reintegration program for ex-combatants to help them transition into civilians' life more peaceful and productively. Community-based intervention. Leveraging local leaders and community groups to provide mental health support. Local and international NGOs running mental health programs to train community leaders to recognize and address signs of traumas and stress, helping to create a supportive network within displaced communities or society, and strengthen referrals for professionals' mental health intervention. Then we will talk about the education and awareness, promoting mental health literacy to reduce stigma and encourage help-seeking behavior. For example, public education campaign about mental health help reduce stigma and increase the number of people seeking help for conditions like depression and anxiety. In my conclusion, I would like us to look at call for action. What do we do? Emphasize the need for continued investment in mental health as a foundation for sustainable peace in post-conflict society. For example, advocating for international aid to support mental health infrastructure in post-conflict areas like South Sudan, where ongoing conflict have severely impacted the population's mental health well-being. Then we will also like to talk about long-term perspective, highlighting that addressing mental health is not just a short-term need, but a long-term commitment to achieving lasting peace. For example, stress the importance of sustaining mental health programs in South Sudan to play a crucial role in the country's long-term stability and reconciliation effort. It's important for us to wake up now and always prioritize mental health for sustainable peace in South Sudan. Thank you so much for listening. I remain Issa Justin Joseph, ICAP Media, voicing peace for all.